Welcome to the African American Wellness Watch. I'm your moderator, George Strait. High blood pressure or hypertension. More than half of all African Americans have it. Too often, some of the medications prescribed don't work as well on us. And too often, we don't know that we have a problem until it's much too late. So what do we do? Well, we have the experts to help us. Our host, Dr. Michael Lenore, practicing physician for more than 40 years, and also former head of the National Medical Association. Taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenore and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. And Dr. Lenore Coleman, an expert in high blood pressure prevention and care and founder of Healing Our Village. Thank you both for being here. So Dr. Lenore, if high blood pressure is a silent disease, a silent killer, how do we know that you've got it or are at risk?
Well, you know you're at risk if you're African American. I mean, that's pretty clear. I think there are some genetic issues and certain unique environmental issues, which also lead to hypertension. So the only way to really know is to get your blood pressure measured on a regular basis, especially if you have a family history of it. They call it silent killer because, you don't know you have it. And there are almost often no symptoms until things are have gone along very late in the game. And so that's one of the reasons that we push so hard to have blood pressure as a measurement that every Black person needs to have on a regular basis, and that number in his hand or her hand.
I guess that there's some risk factors that folks should know that could put them at risk, right?
Oh, absolutely. There's no question. Obesity certainly is one. A family history is another. I think the genetic and the environmental issues kind of come together for African Americans in our society as it relates to hypertension. So I think certainly other risk factors have to do with the kind of diet you have. You may not be obese, but you may be eating the wrong kinds of food, and certainly certain conditions like chronic renal disease and diabetes can also contribute to the incidence of hypertension in any population.
So Dr. Coleman, what happens if my blood pressure is too high and stays too high for a long time? Basically, what can hypertension do to me, and how bad is that?
So let's start with the last question. How bad is it? It's really bad. All right. So one of the things that I have been doing most of the 40 years that I've been taking care of patients with diabetes and hypertension is trying to stress to them that it is important that they know their number and that hypertension is the leading cause of heart attacks and strokes in the African American population. And because it's that silent killer and they don't know that they have it, this damage to their heart muscle, to their blood vessels, both their arteries and their veins. And when you talk about damage to your blood vessels, we're talking about the big vessels that are in your heart and throughout your body. We're also talking about the little blood vessels that are behind your eye, that are in your kidney. And so that is why when you start talking about complications of high blood pressure and these vessels becoming leaky, becoming weakened, and then bursting potentially, then you get your heart attacks, your strokes, your blindness. A lot of folks out there have had laser surgery in their eyes because they had a little blood vessel that burst because of their high blood pressure. But more important, I think, than anything for me, at least in 2023, is kidney disease. Those small vessels, again, in those kidneys are being damaged by that high blood pressure. And that is why we see so much chronic kidney disease in African Americans. It's because of the high blood pressure. Right now, this is affecting 112 million people in the United States of America. So we have got to start thinking about hypertension. Because one of the issues with African Americans is that number that we want to try to get to, they talk about 130/80. So the top number, your systolic pressure shouldn't be no higher than 130, and your bottom number should be no lower than 80. But for African Americans, I need everybody to be down at 120/80, as low as you can get, because all of that high numbers is affecting our organ systems.
If I can press you a little bit on this kidney disease. So if one's kidneys get blown up because your pressure is too high, then what happens? I mean, do you end up on some machine or something?
Right, exactly.
What's your life like then?
Okay, so one of the things that needs to be done every time you go to your doctor, and if you have a history of hypertension in your family, if you have high blood pressure, you need to have your doctor check for protein in your urine. Your kidneys are what filter out all the waste products, etc. But if they've been damaged due to the high blood pressure, they become leaky as well. And so now the proteins that should stay inside your body, they end up leaking out into your urine. And so we can tell if you have kidney damage based upon the amount of protein that's in your urine. And so when folks go for their annual checkup, and everyone needs to do that, right? Once a year, you need to have all your blood work done. You need your mammography, your colonoscopy, all the preventive things that need to be done. And then when you go back to see the doctor, you need to say, can we go over my lab report? You drew blood last time I was here. Can we go over the report? So that you can see your numbers. You'll get to see your cholesterol numbers. You'll get to see how well your kidneys are functioning. All of that is really important if you're a person that has high blood pressure, because if you are spilling protein and your kidneys are starting to be damaged, we want to know early. We want to catch you at stage 1 and stage 2 kidney disease instead of all the way to stage 5. Which is when you have to go on dialysis. And let me tell you, that's not something you want to have to do.
So you raised an interesting issue about how early one starts to look at this. And Dr. Lenore, your most of your practice is with children and with young families. How early do you start this conversation about the dangers of hypertension with young families? How early does that discussion begin?
We're seeing increasingly children who have hypertension, because we're seeing increasingly children who are obese and overweight. So that we take blood pressures as early as 3 years of age, 3 to 5 years of age. And if we see any evidence of hypertension, then we intervene, make sure that there's nothing going on genetically, or that we really have a meaningful value. The thing that's so disturbing, and I think it spills over some of the other things we might discuss in other programs, is a number of children that I see who are morbidly obese. And most all of them have some element of hypertension. So we are really on the case. But I'm telling you, George, it's almost a pandemic of obesity in the communities of children that I see. And along with obesity goes hypertension, and on many occasions, diabetes. So we start very early. As soon as we can get a couple of them, usually at about 3 to 5. And we take blood pressure on every single physical visit after that.
So aside from the fact that we're all going to eat ribs and fat back on 4th of July, and some of us will follow Dr. Coleman's advice and know our numbers, and some of us will follow Dr. Lenore's advice and not do that. But what I'd like to talk about is some prevention, and I'll start with you. Dr. Coleman. What aside from just sort of watching your weight, what are some of the best tips about prevention?
Yes, so I think it's really important that Mike's talking about, morbidly obese kids, and I used to live in California. Now I'm in Georgia, and I have not seen the level of obesity that in California that I'm seeing here in the South, in Georgia and Tennessee, Louisiana, all of that. A lot of it has to do with the way that we, not only the foods we pick to eat, but the way we cook the foods that we eat. So one of the big things is decreasing the amount that you eat. So portions is really a big deal. I know I'm a 70-year-old woman, and I am really having to push back on how much I eat, because I just don't burn it like I used to. So it makes a big difference. And then exercise. Exercise is really important. You know, we talk all about this 10,000 steps a day, which, by the way, is not easy to do. I can usually get to 5,000 or 6,000 without much trouble, but that last 4,000 has to usually be intentional for me. I have to go somewhere and walk around a track or walk around a park to be able to get that whole 10,000 in. But once you get older, when you get in your 50s, 60s, 70s, 80s, it's important that you also do some weightlifting. You have to maintain muscle mass, because that helps your metabolic rate so that you burn the calories so you don't gain the weight. I also think it's really important for African Americans, and Mike's not going to like this, and I'm sorry, but that salt is killing us. We have way too much salt in our diet, and that salt helps us retain water. And so all of that is hard on the heart. So decreasing the salt in your diet, getting used to using herbs and spices and those kinds of seasonings as opposed to onion salt or seasoning salt. And then I know Mike's going to have those greens, right? So that whole, fatback and salt pork, it's called salt pork. Okay, so that might give you an idea that there's some salt in that meat you throw in them greens. So throwing a little turkey in there might not be bad, Mike. It still tastes good, I promise.
What I don't understand is you're talking to someone who can validate. My blood pressure is 130/67.
All right.
So whatever I say might be science.
That's right.
I don't eat salt, and I understand, and I agree with everything you say about the diet. It's not only the quality of what you eat, it's also the portion size. And I think that too often, the problem with hypertension, George, is that in any chronic disease, we're talking about hypertension or asthma, where you have to do something every day. Take a medicine, watch your diet, increase your exercise, things fall apart. And then once they fall apart, it's like one of those dams that the Russians have bombed. And once the gate starts opening, then you start forgetting the exercise. You start forgetting the diet. You start forgetting to take your medicine on a regular basis. And once again, I go back to it starts very early. I often talk to parents who have children who are hypertensive or have children who are obese, and they say, "Well, I don't know. I'm trying to get him to eat the right thing." I said, "Well, you should have thought about that." I said, "A baby can't drive to McDonald's. I see McDonald's full of children all the time." And so I said, if you're going to keep your children healthy, then you have to stay healthy by watching your blood pressure. And you have to start good eating and exercise habits very early in the game. Because once you get them to 12, 13, 14, deal's over.
So let's talk. There are lots of medications for hypertension, and at least some of the medications that the research that I've seen works differently on African Americans, and also some of the medications are problematic for some men. Dr. Lenore, talk a little bit about the medications that are prescribed for hypertension.
Well, I'm going to have to punt this question. Dr. Coleman is a registered PhD pharmacist. And so if you want to know about the ins and outs of the medicine, don't make me make stuff up. Let's talk to Dr. Coleman. Let's talk to Dr. Coleman about that.
Yeah, no problem. So this is really important. There was several studies done actually years ago, which very clearly showed that African Americans require a minimum of medications, sometimes 3, to get their blood pressure under control. And again, our number is 130/80, 130/80 or less. So right now, there are several different classes of medications. There are water pills, the diuretics, that people hear about the water pills. People don't want to take the water pills. But one of the reasons why for African Americans, it's critical that they use water pills is because they tend to retain salt. Not only is their diet salty, but they tend to retain salt. And it actually, I always tell patients about the idea of slavery and coming over on that boat. A lot of people saw the movie Amistad. Okay, so what you saw was a lot of people got sick and couldn't make the voyage. The voyage was for months. So the people who were able to actually land in the Caribbean, land in the United States of America, land in England, those people had to be able to store salt and water. So now fast forward to 2023, that is why it's so critical that people of African-American descent, African descent, have to use a water pill. Just a small amount, not a big amount, but just a little bit. And if it makes you go to the restroom more than you want to, it's because you're eating too much salt in your diet. Once you decrease your salt, you won't see that that's a problem. There's also drugs that slow down your heart. Those are the beta blockers. There are drugs that actually work at the area of the kidneys. So those are your ACE inhibitors and your angiotensin 2 receptor blockers. Those agents actually don't work as well in African Americans, so you have to use higher doses. So that's one of the mistakes that are sometimes made out there, is that the doctors are kind of concerned about pushing the dose. But for African Americans, for those two classes of drugs, ACE inhibitors and ARBs, you have to use the higher doses.
If I can stop you right, doesn't that speak to an issue about the race of the doctor that you see? Because I'm certain that African American doctors know about this, whereas white doctors and non-African Americans may not.
Yeah, no, I really am a firm believer in having some cultural congruence, so that African American folks are going to see African American doctors if at all possible. But even if they don't have one in their community, then that means it's on them to make sure that they know that the kinds of things that they need to know. The other thing is one other class to mention is the calcium channel blockers. I just want to mention that they tend to work really well. There's a lot of good data that they work really well in African Americans. So again, I guess the most important thing is you got to take 2 to 3 drugs to get it under control. If you lose weight, get your exercise, watch your salt intake. Sometimes you can come off of some of the medicines, but that has to be a choice. You have to choose to want to change your lifestyle to be able to make that happen.
And I don't mean to be flip about this, but we talked a bit about the causes of hypertension, and I've read some literature, Dr. Lenore, that really does suggest that racism plays a role in why so many African Americans, on a percentage basis, have hypertension. Do you buy that?
Oh, I don't think there's any question that racism or any stress increases the incidence of hypertension. And I think that the stress that Black people are under on a daily basis has been documented. For a long time, it was something we said. I think my mother saying when we moved to Dallas and we had to move out of that neighborhood because we didn't know it was segregated, she said racism makes her tired. And I think that's the attitude that many, many Black people have, is that it's a subtle, kind of invasive, constant, steady drumbeat of stress. It happens on the job, it happens at school, it happens almost in any element of your life. And I think that certainly looks to be one of the major causes of a lot of chronic diseases. I would say that, to your point about Black doctors, there was a study recently that shows that if you have more Black doctors in your community, the level of control for chronic disease among Black people is much higher, just having them in the community. And so consequently, I think that they understand that, that racism makes you tired. And racism causes the stress. And now they're being able to connect some of the brain chemical functions with the onset of racism. So I think everybody that will say that racism is a major factor in the stress that Black people feel. Stress is always a major factor in the development of hypertension.
There's no question that this conversation could go on and should, but we've reached the point where we have to at least pause And so what I'd like to do is thank Drs. Lenore and Coleman for an incredible conversation with lots of great information for our audience that they can use to address the questions that they may have about hypertension and high blood pressure.
And George, I want to say that
sure.
everything that Dr. Coleman said about the medicines was exactly what I was going to say. Only she said.
Of course, and I'm absolutely sure that is indeed the case. But if anybody's got any more questions about the medicines and all the rest, we've got a couple of websites that will really answer all of your questions. There's a lot more on our website, AfricanAmericanWellnessProject.org. That's all one word, the AfricanAmericanWellnessProject.org. And Dr. Coleman's website too, HealingOurVillage.com. That's all one word, HealingOurVillage.com. Dr. Lenore, any closing thoughts?
No, I think that it's good to have these programs periodically because I don't think that as many people appreciate the role that hypertension plays not only in your day-to-day existence, but certainly in your quality of your life, but also in your lifespan. And anytime we can talk about hypertension, I think that's a good day. This program is sponsored through an educational grant from AstraZeneca Pharmaceuticals.